Okay, good afternoon, everyone. Okay, I am Hwee Koon. Currently, I'm the team lead for the sports medicine division within Singapore Sports Institute. My training is from sports physiotherapy perspective. So today, my topic is just gonna share with you regarding how Team Singapore actually cope with this COVID-19 pandemic, and that Singapore being having to go through a kind of a modified lockdown, which we call a circuit breaker, and how Team Singapore is actually coping with that, and our plans towards preparing for the up and coming Olympic Games and Paralympic Games. Okay, so a little bit more about Singapore Sports Institute. So we base on our on this vision and targets about trying to provide sports science and sports medicine support for some of our national athletes, and that we hope that within the next 3 Olympic cycle, we would have consistent participations and success in Olympics, Paralympics, and World Championships, and also do well within the continent and within the region of Southeast Asia. So with that, the team itself comprises of sports medicine and sports science, and with divisions from nutrition, psychology, biomechanics, physiology, and strength and conditioning, other than the medical team that comprises of physios and doctors. So just a little bit of an introduction. Between 2nd to 7th of February, actually a team of us were in Tokyo doing the final recce to prepare for our Olympic Games and our Paralympic Games. During that period of time, we already have certain news about the COVID-19 pandemic or cases of COVID-19, and Singapore, with ourselves, we had a first case of COVID-19 case, which is an imported case on the 26th of January 2020. So with that, I'd like to bring you through a little bit of a timeline of what Singapore had gone through during this pandemic period. So we had a team of us scientists and physios and medical team, together with our major games organizer team. We actually went to Tokyo for our final meeting to actually finalize our planning for Tokyo Olympics and Paralympic planning. And on the day of our return, it happens to start that we actually had, Singapore had a confirmed case of community spread COVID-19 cases. And so with that, on the February 7th, we went into a DORSCON orange status. And that with that comes with numerous safety measures that were put in place by various government agencies. Followed by that, April 3rd, we declared, our Prime Minister declared a circuit breaker announcements, which put us to go into a kind of a modified lockdown where most of the workforce in Singapore were asked to work from home. With that, that was advised that the circuit breaker will last for a month. However, on the 7th of April, the announcement was that it will extend the circuit. On the 21st of April, there was an announcement for the extension of the circuit breaker for another month. We ended our circuit breaker on June 1st, and then we went on to start what we so-call a phase 1, followed by phase 2 of our post-circuit breaker. Okay. So with the onset of DORSCON Orange, what Team Singapore has encountered was that we faced with various implementation of social distancing and other safety measures that are put on by our government agency. Okay, on top of that, gradually we receive news and we also get notices about the increased cancellation of international competitions. So we have a couple of athletes that had gone, already planned and had traveled to their various international competition venues, and that upon arrival there was notice about cancellation and that they were flown back immediately. We also had notices about the cancellation of competition, which for events that were happening, in 3 weeks or 4 weeks' time. On top of that, we also have been monitoring and got news of international athletes, being affected by COVID-19, whether they are down with COVID-19 or they actually had officials that had COVID-19 symptoms. And with that, SSI's medical and science team actually have to reorganize ourselves and also reorganize our service delivery model to actually ensure that we comply with the government's safety measures implementations. So with that, there was a lot of reorganization of resources, facilities, and also manpower, because part of our services, some of our physios and some of our doctors basically move between hospitals or private clinics and coming to our sports institute to provide services. So with this implementation measures, one of the requirements is that all healthcare, especially the face-to-face front-facing service staff, would not be able to cross institutions. So with that, that affect a lot of our coverage, including our overseas travel support and coverage because of the implementation of the no crossing of institution. And for a lot of our medical staff, we were not allowed to actually travel overseas in view of the cases of COVID-19. There was also with that, a high-performance team was also coordinating with various sports association and the national athletes, to monitor some of these athletes who are based overseas or who are competing overseas on the impact of COVID-19 on their training and on their competition. So with that, we actually have to move quite a lot of our athletes who are based in Europe and various countries, including USA, back to Singapore. And during that period, Singapore also had recommended that a lot of the students who are studying overseas to be moved back to Singapore as soon as possible. So with that, we actually have to do quite a lot of last-minute arrangement to arrange for our athletes to return to Singapore as soon as possible. A couple of our sailors were stuck within Portugal, and that we actually would have to got them to rely on our Singapore embassies to actually help to arrange for their return. And with that, some of these athletes whom returned, they will still have to be put on stay-home notice or put on quarantine of 2 weeks, depending on where they return from. Other than that, our medical and science team also comments on reviewing our current procedures and protocols to ensure that all safety measures were being met. Okay, With that comes with the announcement of the circuit breaker, we actually have only 4 days to prepare for the circuit breaker, breaker measures. So what this circuit breaker comprise of is that as far as possible, almost other than public transport and healthcare personnel working in the hospital or some key position, all the rest of Singaporeans are supposed to be working from home and stay from home, stay within their home. So with that, our coaches, our athletes were faced with very unique challenges, which is the disruption of their training routines, their competition schedule, and that the possible changes of their nutrition and their psychological well-being was also affected. Our overseas return athletes also, end up having to be quarantined in designated accommodation for 2 weeks all around Singapore. With that, our SSI scientists have to coordinate with various sports associations where we have to provide home-based training solutions, including some loaning out of equipment for our athletes to bring home in order to continue with some form of modified training. And that we also start to actually to prepare a lot of sports science resources for our athletes and coaches. The medical team, on the other hand, had to provide and look into providing a hotline for remote triage and consult. So, which is a hotline that any of the athletes or our coaches could call to actually inquire about the management of their injuries. With that, we also have to prioritize our existing athletes with injuries on either they receive limited face-to-face treatment or we continue managing them via telehealth. Sports medicine resources were also provided for some athletes, and that we also have to monitor for COVID-19 cases among athletes and coaches, because there were still a number of athletes that had just returned from overseas and coaches, moving around within different countries. Right. So we during circuit breaker itself, we had to come up with a plan within 4 days, and with that, we also need to come up with a monitoring plan. And with that, we start to monitor 4 key areas. So we were concerned about that our plans would need to be targeted, and that we want to actually look at the impact of this change of this training environment in pertaining to the quality of their training and the mental well-being, and also looking at the feedback about the limited resources and the modified training methods, and that how effective was SSI's sports medicine and sports science support for our athletes and coaches. So part of this COVID circuit breaker implementation was to come up with a monitoring system, and also looking at creating a survey form to allow athletes and coaches to provide feedback to us. Okay, so these were the areas where some of the questions that we put on in an online questionnaire, where we get our athletes and our coaches to provide feedback. On top of that, for the sports medicine team, we also continue to actually monitor for new injuries that were sustained due to the change of training routines. So we need to provide a triage, a hotline, a triage, and also to monitor what are the types of new injuries that were sustained during this COVID circuit breaker period. We also have to continue managing existing injury, being whether it is acute or it is due to their repetitive or load-related injuries. We also commence and continue with injury prevention program, and that we make use of this circuit breaker period to actually impart knowledge on recovery, injury prevention, and performance enhancement strategy. On top of that was to continue with the existing performance enhancement program that we put in place with some of our SPEC scholars. Right. So this is also a survey that we created for the coaches. So that's to basically allow them to provide us with some of the feedback that on this whole change in training regime and training program and the service that are provided for them during this circuit breaker period. Okay. So within this whole circuit breaker period, we also commenced planning for the return to training post-circuit breaker. So one of the things that we need to make sure is that, by the time we return to training after this circuit breaker measures have been lifted, is to make sure that, all athletes still continue to comply with safety measures. All right, that we also have to reorganize resources, facilities, and our manpower to cope with the safety measures and to also optimize, enhance safety for our athletes. With that, we went in to brief athletes and coaches on enhanced safety measures and other social distancing measures. And with that, we also had multiple sessions, workshops to actually caution our athletes and coaches on the potential load adaptation or load-related injuries upon returns to training. So with this, our emphasis is that we would try to optimize health, minimize unnecessary injuries, and also making sure that our athletes and coaches comply with safety measures to ensure that their whole training program and their training environment is safe. Part of this whole circuit breaker or safe return to work and return to training measures is that our government has imposed not more than 5 in a group policy, where being in sports participation, in training, or in all social environment, you cannot have a group of more than 5, and that there is no mixing of different groups of 5. So with this, it actually makes, and with a place facilities within sporting facilities itself, and depending on the space and the size of the facilities, we will not be able to have more than 50 people or 10 groups of 5 in and enclosed facilities at one point of time. Within this 50, 10 groups of 5, there has they cannot have intermixing, so the groups cannot be mixed together. So this actually poses a challenge for our athletes training. For our swimming, the pool has to be split into 2, where athletes have to be grouped into groups of 5, and that each group has one coach, and that the athletes, the groups, will not be mixing with other groups. And then with that, we ended up having to split swimming pool into 25 meters pool, where only 2 groups to 3 groups can train at one time, which means that 2 groups or 4 groups of 5 could only train at one time, because there are only 20 lanes within that facilities. So all training plans for swimming would have to be staggered, so that if they were to train So in the initial training programs, because of this limitation, the teams were only allowed to train once a day instead of the usual twice a day training sessions. So coaches would have to make up for that changes, and that they would have to look out for land-based training to actually complement and to compensate for that one single training session. However, even with the land-based training, it make it extremely challenging because the other safety measures that's being implemented is that during exercise, each person has to be kept 3 meters apart. So with our gym setup, within the circuit breaker period, we have to, within a week or so, to make sure that we change our gym setup, including our physio treatment room and rehab facilities setup, to make sure that we comply with that 3 meters rule between each exercise station. With that, it became a little bit challenging. So the other strategy that we put in place was to actually have we put on a plastic water resistance shield that is being put in between each exercise station for areas where we cannot ensure that there are 3 meters, that they can keep a 3 meters distance. So these are some of the challenges that we had, and that also our strength and conditioning team and our physiology team would have to stagger all the sports and the teams to come at very designated time for their gym and workout session or their exercise testing session. So this makes this became a limitation in a way because within a specific time we can only have a very limited pool and group of people, and with that a lot of our athletes training were compromised because from 3 S&C sessions a week, they may have to be down to 1 or 2 sessions a week, etc. Okay. So with that, we move on. So once when we move on to the post-circuit breaker, which is on the 2nd of June, where the government starts to free up certain safety measures, and that's where the physio clinics is allowed to reopen with very limited time to see patients. So we have to stretch from seeing an athlete every half an hour to make sure that we see an athlete every hour, and that different therapists will take in different time slots so that we don't cramp up the waiting area, and we also cannot crowd too much crowding within the physio department. So with that, the first phase of post-circuit breaker period, we allow the SSI spec scholars to return to training. So these are basically some of the swimmers, table tennis and badminton players were allowed to start to resume their training. So when they return to training, the medical team basically were on standby to monitor training outcomes and also to monitor the potential injury symptoms. We also have to make availability to provide immediate rectification of potential injury symptoms, which means that when they start training and if they sense that something is not right, they have an immediate access to the physio team so that we can actually do a quick assessment and determine how whether they are safe to return to training or they need certain modification, or whether we need to put in place some alternative implementation. We also need to will continue to put in place injury prevention programs and or continue with our performance enhancement program with some modification. And that's where, because after 2 months of circuit breaker, where we moved some of our overseas athletes back, there were some of them were eventually getting ready to move back to their universities or to where their training base are. Okay, with that, we continue to actually have a remote monitoring of these athletes overseas. So majority of these athletes were returning back to US and Europe, either for their studies or for their training and study at the same time. And that we start to review on the training resources allocation and the safety measures outcome. We kind of improve on that phase 1 measures, and that so that it allow us to prepare for phase 2 return to training measures. During phase 2, we got more athletes returning to training. So phase 2 were commenced after 2 weeks after our phase 1 measures. So during this phase 2, more and more sports were allowed to return to training. Mainly some of these sports were mostly the team sports, and some of the other water sports such as diving, synchronized swimming, water polo, and our kayak and canoe team. And with this, again, it's still to ensure that all training is 5 in a group. There's no mixing of athletes or mixing of groups, and that they come in a staggered manner so that there's to ensure no crowding. With that, we're still reviewing on the current training resource allocation and safety measures. And at the same time, we are currently preparing for phase 3 of returning to training measures. And phase 3 would likely also include traveling and also competition. Currently, we are still in phase 2, but however, within this phase 2 phase, this is the second month into phase 2, and there were a few modifications and a few changes in the safety measures. However, we're not anticipating that phase 3 will come very soon, in view of not because of the cases within Singapore, but in view that cases within international are high, and that restrict the cross-border, and that restrict a cross-border, and is something very important for Singapore because we rely on visitors, and also we rely on a lot of traveling to actually maintain our economic income. So with that, what we did during the circuit, currently what we had a review of our circuit breaker measures, and this is a survey that was compiled by some of my SSI, sports science, sports medicine colleagues. They actually got the athletes and coaches to report within the questionnaire or the survey. And one of the things, these are some of the outcomes that has been reported. So one of the concern was that both coaches and athletes were concerned about that this change of home-based training was affecting their fitness, and that they have limited technical practice, and also the lack of training intensity and volumes, and the lack of supervision. So this concern was pretty high. And also with the engagement from athletes and coaches, the weekly engagement with athletes and coaches, all of them reported that, training at home was very limited. So, for some of them, some of the athletes were lucky enough that they were able to loan some of the critical equipment back home. However, there were some athletes that, have to rely on resistance band and body weight type of training, and that limits the training intensity and the variation of their training. The other one was the second portion was their concern and the changes in their well-being and nutrition experience. So one of the concerns that they reported was that the loss, the emptiness, the worthlessness, the anxiety, and there are some that was had reported on grief. I will have to highlight on this that the grief portion were reported mainly because there was a sport. One of our sports team had lost one of the coaches due to illness, and it was quite a very shock and sudden event. And that with that, there was a component of grief during this circuit breaker period, because they were all based on home. They were not able to see each other as a team and to actually talk and grieve together with loss. And so with that, there was a small group of athletes that actually reported on grief. So it's actually very specific to that they lost a coach during circuit breaker period. Okay. And that the next thing was the access to facilities and equipment. Because training from home, it was extremely challenging. And if you know, 80% of Singaporeans stays in high-rise apartments. So with that, making exercising and training at home very, very challenging. Even with some of the apartments with gym and exercise facilities, during the circuit breaker period, all exercise gym facilities, including swimming pool, were closed. So the only place that you were able to exercise outdoor would be running and brisk walking, cycling in the park. So that makes training very challenging. We do have an athlete or two athletes that are sisters, and they stays with their family of 7 in a 3-bedroom, 2-living hall apartments, and they would actually have to fill up their living rooms with ergometer because they had to bring their kayak ergo back to home to continue with the training, and that's made training extremely challenging. Having to share space with family members in a very enclosed place. We also have athletes that reported that they have to end up going to the multi-story car park to actually do some of their functional training, and that they would have to modify exercises just to cope, just to maintain fitness and cope and maintains their skills capability. Lastly, the area that a lot of our athletes coaches had feedback is that they felt that with the sports medicine and sports science support from our SSI were very useful, and they actually benefited, and they realized that during the circuit breaker period, it was one of the best and most enriching time where they actually learned a lot of sports science and sports medicine and injury related knowledge with the engagements that we had with them, right? So all these sports had various specificity. Some sports were more targeted that the physio were the one that were monitoring them more closely, whereas certain sports like shooting, they had psychology that were working with them more as compared to the other sport science services. And that also there were some of the sports like swimming and badminton that actually have the S&C coaches supervising them and working on them through Zoom on their exercise program, etc., etc. So they find that such sessions and such one-to-one sessions were extremely beneficial. Okay, so with that, what I would say is that our conclusion and our Team Singapore approach is that with our limited resources in Singapore, one of the challenges is that our badminton players are still training 5 in a group. That make them extremely challenging because they can only spar within these 5 athletes itself. And that our combat or our martial arts athletes cannot even spar, although they could actually resume training, but they are not able to, they are not allowed or they're not able to actually do sparring or comes into human-to-human contact within their training itself. So hence this make part of the training very challenging in terms of sparring, because like badminton, they only had that 4 other teammates to spar on, whereas martial arts sports, they cannot even do any sparring at all. So there was some of this limitation. However, with the Team Singapore approach-wise, it's all about ensuring safety first, and that we continue to use evidence-based strategies and approach, and that we innovate and we make the best of what we can right now to train, and that hopefully we could use this. It's not the best way, but at this moment, I think using this approach to try to optimize training as much as possible. So with that, I think I've finished with my presentation and like to open this to questions later. Thank you.